What's good, ladies and gentlemen? It's yours truly, the Lupus Phenom, aka Duke, live in your living room again, coming at you with another one. I know it's been a while. I've been a little busy, tied up, working, and things of that. But it's something interesting that I wanted to share with you guys and girls. Um, it comes from the Lupus Foundation of America. I'm not sponsored by them in any way. This is specifically their content that I'm going to expose to you. I'm going to read what it says verbatim that's coming from them, but it's interesting, and I'd like to know your thoughts on it at the end once I'm finished reading it. So let's just get into it. Now, once again, I say this is from the Lupus Foundation of America. Because lupus can cause a lot of different symptoms, there are many different kinds of medicines that can treat it. There are currently only a few medicines specific and just for lupus. Everyone is different. To assure there are options that are safe and effective for everyone, participation in clinical trials is important. If you have lupus, or you can help by volunteering to take part, there's this clinical study that they're having, and it's I find it kind of interesting. They're actually taking participants to participate in this clinical study. Now, the clinical study, there's two different identical active systematic lupus erythematosus, or SLE, clinical trials evaluating the safety and effectiveness of an investigational study, medication in adults with SLE. Both are now underway and accepting participants. Now, the participants will be randomly assigned to receive either the study medication or a placebo. All participants will continue to take their usual lupus treatment while on study medication. The study medication, or the placebo, is one tablet taken by mouth twice daily. If you are eligible, you would only participate in one of these two studies. Remember, taking part in the clinical trial is voluntary, and if you enroll, you can choose to leave the study at any time. So they're giving you an option if you may have some type of symptoms, or you may have some type of reactions to it, or you just simply don't feel comfortable. It seems that you can leave at any time. Now, you may qualify for one of these research studies, and the following eligibility criteria, you know, um, needs to be met, or if they're met, be 17, or excuse me, be 18 to 75 years of age, having been diagnosed with SLE, which is what I have, SLE, and currently have a rash and or arthritis due to lupus, have positive antibodies, ANA or anti-dis DNA or anti-Smith based on laboratory screenings. Be on treatment for lupus with anti-malarial or immunosuppressant medication, or one of each. Not have another autoimmune disease except type 1 diabetes mellitus, or thyroid autoimmune disease, celiac disease, or secondary uh, the SJ, I believe, or it's the Scrowen's syndrome. So the criteria will be explained in the study, so you can learn more about the studies. And also, I'll leave the link below. But before choosing to participate, you should speak with your doctor. This is all coming from them. Your proximity to research sites should not limit your participation in a clinical study. Reimbursement and compensation for your travel and time to participate may be available. So the research is accelerated by you, but it says Ray. Now, choosing to participate in the study is an important personal decision, which I agree. It's something that you really need to consult with your doctor about, and something that you really need to contemplate and think about clearly before you make that you know decision. So you also, it says, talk with your doctors and family members or friends about deciding to join the study. If you are a person living with lupus or a caregiver and want to learn more about the clinical trials and other research opportunities, that may be right for you or your family member living with lupus. And as I mentioned before, there is a link below. Um, I haven't thought about participating in it, but maybe some of you that's out there may be interested in it, and I just wanted to bring it to your attention. So if you're interested in it, you know, leave your thoughts in the comments below. And if you may already know about it because you may be subscribed to the Lupus Foundation, which I am. So I get a lot of their content, a lot of their emails, and and stuff. So, but let me know your thoughts below. As mentioned earlier, I'll leave the link um, in the description below, and so therefore you can kind of look into it and evaluate it before you make any irrational decisions. So once again, it's yours truly, the Lupus Phenom. Love, peace, and hair grease, and I'm out.